Hi, I am Dr. Rohan Vakta. I am sports orthopedic and arthroscopic surgeon in Ahmedabad, Gujarat. Currently, I am working in Ash Arthroscopy Center and Zydus Hospital as a sports medicine consultant and arthroscopy surgeon. So friends, in this video we are going to discuss about the shoulder dislocation. Shoulder dislocation is a very common condition, and the most common joint to get dislocated in the human body is the shoulder joint. So the God has created shoulder joint as a ball and socket type of a joint, but the socket in front of the ball is very flat, so that we get good mobility and flexibility for the shoulder joint to do day-to-day activity as well as to play sports. But at the same time, because of this high mobility, it is highly unstable joint. So the stability of the shoulder joint depends on the surrounding muscles and the ligaments. So whenever there is an excessive force, like falling from the two-wheelers, another types of road traffic accidents, contact sports, or falling from the height, falling from the stairs, different ways of traumatic injuries, a shoulder can get easily dislocated and the ligaments or the muscles can get torn. So the most common pathology which leads to shoulder dislocation is a Bankart lesion. In Bankart lesion, there is a ligament inside the glenohumeral joint that is known as IGHL, that is inferior glenohumeral ligament, gets torn, and the humeral head, that is the ball of the shoulder joint, becomes unstable over the socket, that is the glenoid bone. So because of this instability, whenever a person tries to do an extreme movement like throwing a ball, combing the hair, while sleeping also, or driving car or taking something from the height, a ball can get dislocated from the socket. That is known as glenohumeral dislocation, and another name is the Bankart lesion. Because of this Bankart lesion, there is chances that there is a further bone loss because of recurrent instability. So in that scenario, if the person's age is younger, like less than 35 years, then the chances of future dislocation becomes quite high. So how to diagnose this condition? So diagnosis is done clinically as well as radiologically. By clinical examination, you do a test that is known as the apprehension test, and radiologically we confirm our diagnosis by doing the MRI. After doing the MRI, the consulting doctor sees the images and look for the ligament injuries or the bone loss in the shoulder joint. Based on the MRI, the further treatment is advised. If there are not many dislocations and there is purely ligamentous injuries, then we advise arthroscopic surgery. Name of this surgery is the arthroscopic Bankart repair, where we insert a special type of suture materials that are known as the all suture anchor to repair the ligament over the bone. It is done by keyhole surgeries. There are small 3 to 4 holes by which we insert 3 to 4 stitches and repair the ligaments in front of the bone. But if the bone loss is very high, there are high episodes of dislocation in the past, then if we do arthroscopic surgery, then there are chances of failure is also high. In that scenario, we do a open surgery that is known as Latarjet surgery. In that case, we transfer a bony block in front of the glenoid to increase the arc and the size of the socket. So that bone is given inside the shoulder joint, that is known as the coracoid process. So we cut the coracoid process, transfer to the base of the glenoid and fix with the 2 screws, which will increase the size of the glenoid. The attached tendon to the coracoid process will provide a sling effect, so the stability is increased and the chances of dislocations are almost zero after the surgery. So based on the MRI, either of these 2 surgeries advised. Thank you.